Okay, guys, today we are going to talk about eye and ear diseases and disorders. So, another thing I wanted to tell you real quick is Chapter 17 has already been recorded. It is on the content. So, what I'll do is I will work on recording, or I'm recording this, and then I will work on converting it to a D2L recording, and hopefully I'll get it posted either tonight or early tomorrow morning. Okay, so the anatomy and physiology of the eye. You guys know that it is located in the orbit of the skull. The components, the sclera, the cornea, the iris, and the pupil. It has both anterior and posterior chambers. In the interior chambers is the lens, the retina, the choroid layer, and the posterior cavity. And I don't really like how they set up this slideshow because we bounce back and forth between the eye and the ear, but at the same time, it'll keep us from being bored. So the external ear, the pinna and the auditory canal. The pinna, I always tell everybody, is the part that gets pierced, okay? The middle ear is known as the tympanic cavity, okay? The middle and the external ear are separated by the tympanic membrane, which is also known more commonly as the eardrum. Okay. In the middle ear, there are also three bones, the malleus, the stapes, and the incus bones. And those bones actually transport sound. They do it by vibration. So, like when you are driving down the road and a truck comes by you and your car vibrates, that's kind of how the bones work. They vibrate one thing to the next thing to the next thing. The inner ear is very sophisticated. It contains the vestibule, the semicircular canals, the round window, and the cochlea. It is the area of the ear which is responsible for equilibrium, for balance, um, for hearing because it connects to the auditory nerve. And the cochlea is what we call the organ of hearing. It looks like a snail, and it's got lots of spirals in it, and the sounds get magnified and sent to the auditory nerve using the inner ear. Okay, so as far as eye disorders go, this is pretty much common sense. Okay, anytime you pain or burning in around the eye, issues with visual acuity or the ability to see. When we talk about visual acuity, we are talking about blurriness. That's the simple term for blurriness. So, you can see flashes of light. People can have a phobia to light when they have eye disorders. And most often, even along with the pain, is eye redness. Okay, that's what we call the bloodshot eyes. That's where the tiny little capillaries in the white part just start to break. As far as signs and symptoms of ear disorders, pain in the ear, deafness. Deafness has a lot of different degrees. It can go from I can't hear out of it, I can hear muffled noises, to I can't hear anything. Vertigo. Vertigo is a feeling like you're unbalanced or you're going to faint. And tinnitus is also known as ringing in the ears. Okay, so how do we diagnose eye disorders? Um, they can use the ophthalmoscopy. Okay, they can do the visual acuity test. That is where you look at the letters in the distance and see what's going on. They can use tonometry to measure pressure in the eye. They can use slit lamps to see if the eye is responding to dilation. And they can even do angiography on the little tiny vessels in the eye. For the ear, there's basically only a couple different things we can use to help diagnose the ear. Otoscopy, or the machine where they put the end on it and they turn the light on and they look inside your external ear canal. They can check damage in the external canal, and they can look at the eardrum or the tympanic membrane to see if it is what I call almost shiny and translucent. It looks almost silvery when it's happy. When it's not happy, it can look opaque or more white, or it can look bright red if it's infection. And the other thing they can use for the ear is audiometry. This is where they use a series of tones to measure your hearing: high pitched, low pitched, medium pitched. They also use a series of words to hear which letters people are picking up. And audiometry is used not only to diagnose the degree of difficulty with hearing, but it's also used to help fine tune hearing aids. Okay, so start with some refractive errors of the eye. Okay, and this is the inability to focus images on the retina. Okay, 1/3 of the population is affected, and we get glasses for that. So there's a couple different types of refractive errors. The first type is myopia, and this is nearsightedness. And nearsightedness means you can't see objects far away. Okay, so you can see the computer screen, but when you go to look half a mile down the road or way across the room, you can't see things real clearly. Okay, whereas the opposite of myopia is hyperopia. Okay, and that's farsightedness. That means you have issues seeing close objects. So, for instance, like I cannot see to read without my glasses, but I can see at great distances, no problem. The next type is presbyopia, and this is age-related hyperopia, okay? And if we go back to hyperopia, okay, that's issues seeing close objects, and that is why you will see tons of people wearing reading glasses as they get older. They just don't know what happens, but for some reasons, we just aren't able to focus on close objects. And the last type of refractive error is an astigmatism. Okay, this is does not have to do with the retina, but it has to do with an irregularity of the cornea surface. So you will have blurred or fuzzy vision and see halos. So for all of these things, you can use glasses to correct the issue. There are different surgical treatments that we can use for refractive errors of the eye. There's radiokeratotomy, lamellar keratoplasty, photorefractive keratotomy. There are implantable contact lenses, which does not sound good to me, but if somebody doesn't want glasses, these are all things that they can do to try and correct the eye problems. Again, there's a conductive keratoplasty, there's the LASIK procedure, there's thermal keratoplasty, and monovision. These are all different types of surgical procedures that you can do if you choose not to wear glasses. The tricky part is they don't always work. You'll hear a lot of advertisements for LASIK right now, and that's great, but it doesn't work for all types of refractive errors. So there are a lot of people who are disappointed when they realize that LASIK won't work for them. Conjunctivitis is an inflammation of the conjunctiva. The conjunctiva is basically the watery coating that covers your eyeball, and it covers the inside of your eyelids. So it almost lubricates the eye on a constant basis, okay? Um, it's very thin, so if there's a tear or an injury, you're going to get a lot of tearing, itching, burning, pain, okay? Um, the first thing is you want to apply some warm compresses, use anti-inflammatories, pain medicine. If it's an injury with infection, they're going to prescribe antibiotic ointment. Um, They say for prevention, good hygiene is important. Yes, washing your hands is important, but sometimes things still fly into your eyes, okay? Blepharitis is an inflammation of the edge of the eyelid, the eyelash follicles, and the glands. It can be caused by bacteria. It can be as the result of an allergic reaction, or we can see it with seborrhea. Um, One of the things this happens in our older population, again, because it can be a personal hygiene issue where they're not washing their faces as well as they should. Um, they do make little individual wipes that people can do. They're available right with the contacts and all the eye drops in all the pharmacies and box stores. It just keeps the gunk literally from building up on eyelids and eyelash follicles. Um, it isn't as prevalent in women who are younger because they tend to wear eye makeup and they wash their eye makeup off every day. So it kind of takes care of this, but you can also ultimately see it just looks like a gunky layer of things right where the eyelid meets the eyelash follicles, and it literally needs gently scrubbed off every day. They'll be red, swollen, crusty. Um, so the first thing is to clean it really well. And then the other treatments that an eye doctor can prescribe, if just cleaning it doesn't take care of it, is they can give antibiotics to put on it. They're kind of gunky and they get in your eyes. Allergy medication, treatment of the seborrhea. Keratitis, though, is an inflammation of the cornea, which is caused by trauma or infection. Okay, it's usually unilateral. It usually only happens on one side. Okay, because usually only one eye gets injured at a time. Okay, so if we have an inflammation of the cornea, you're going to always have sensitivity to light. The photophobia is a big indicator. Pain, your eyes are going to be tearing constantly because they're trying to wash out whatever it is that is stuck in there. Okay. Um, Again, the treatment can be antibiotic ointment or drops, pain medicine, an eye patch. A sty is also known as a hordeolum, okay? And this is when one of the sebaceous glands of the eyelid gets infected, okay? You're right, it does resemble a pimple. It's usually caused by staph, okay? Usually it will go away in a couple days with warm compresses, okay? But sometimes, okay, you may need, if it keeps getting bigger and bigger and bigger and not resolving, you may need topical drops or an ointment, or they may actually give you oral antibiotics if they're trying to get it cleared up from the inside out. Um, A cataract is a clouding of the lens. Okay, you can visually see them when you are looking at someone's eyes. Okay, they are caused by changes in metabolism and nutrition. Okay, they are a symptom of aging. Usually, we do not see young people with cataracts. Okay, this causes decreased visual acuity, so you usually have some blurriness. Um, if they get really bad, they will replace the lens. Um, but most people tend to not get them operated on until they are completely affecting their vision to the point where maybe they can't drive or can't read or can't see to do things. Glaucoma is a disease that's caused by excessive eye pressure. It usually happens very insidiously, and people have it happening to them without them knowing. Okay. A lot of permanent damage can occur before people even know something's going on, before they feel a pressure. So they can use eye drops every day. It's called Timolol. It's like a blood pressure drug for the inside of your eye. And glaucoma can be surgically corrected if they can get it before it gets too bad. Nystagmus is a constant involuntary movement that affects one or both eyes. Okay, it's where the eyes just have rapid movements constantly, blinking, moving, and it's very hard to look at patients when they have this, and they are usually very frustrated too. The biggest cause is a brain tumor. It can be a side effect of some other um, neurological diseases. Okay. We see this in chronic alcoholics, but sometimes there are people are just born with defects of the eye that causes this. It could be a muscle issue. So the treatment is to always correct the underlying cause. Okay. Strabismus, all the eye terms are they sound like clouds to me. Okay, so strabismus is when the eyes fail to focus in the same direction simultaneously. Okay, so one eye is looking right and the other eye could be looking forward, or vice versa. Okay, it's always due to a muscle weakness. Okay, so the treatment is they try to get this usually starts when people are very young. So they try to get treatment very early. They will cover the normal eye, and that trains the muscles in the affected eye to function more clearly. They can give eye exercises. They always try to do those two things before they go to surgery, and usually corrective lenses are something that's post-surgical also, but this is a very important reason why we check babies' eyes at every visit, why we check kids' eyes at every pediatric visit, because it's something that can be corrected very easily when they're young. Macular degeneration is something that goes to people who, as they get older, okay? It's a degeneration of the macular area of the retina. They don't know exactly what causes it. They just know it happens as you get older. And what happens is you lose your central vision. When you are looking ahead, say you were looking at your computer screen like you are now, there would be a big round black circle right in the middle of the screen. So if they can catch it early, they try to do laser surgery to improve the vision. But this causes a big problem with driving in our older population. One of the things you will do is you will see people driving while it looks like they're looking out of the sides of their faces. And what they are trying to do is get that black hole to move. And it doesn't always work. Diabetic retinopathy. Okay, this is the leading cause of blindness in the United States. Why? Because we have a high prevalence of diabetes. Okay, so diabetes mellitus, which is adult onset diabetes, causes vascular changes in the retina. Okay, so it makes the blood flow to the retina to decrease. Okay, which results in a decreased visual acuity. Okay, so there are a couple things we do. We monitor diabetics' eyes. We tell them they should get a good eye checkup every year because we can correct this, okay, by controlling their blood sugar. And another treatment they can do is photocoagulation. I don't know a whole lot about it. All I know is that it is imperative that we can control the blood sugar in a diabetic because their eyes are one of the first things that can be affected. Color blindness is also called color vision deficiency, and it's the ability to see color. It can be inherited, or it can be something that occurs as we age due to the yellowing of the lens. The most common ones affect the ability to distinguish between red and green. There is no cure for this. People will say, well, how can people drive if they are colorblind? Because for some reason, even though they can't distinguish between the red and the green, they seem to be able to hone in on the brightness of stoplights, which allows them to continue driving. All right, now we're going to flip to infections of the ear. Otitis media, okay, an inflammation of the middle ear. It usually affects infants and young children the most, but it can affect all of us. When we get a common cold, it can back up inside our middle ear. Um, there's a couple different types. Usually the liquid that comes out of an infected ear is clear, but it could also be pus filled. Okay. The treatment for otitis media, decongestants, analgesics, and antibiotics. They used to prescribe antibiotics all the time for kids that have ear infections. They are trying to get away from that because kids can have an ear infection once a month when they're little. And they're trying to get away from the overuse of the antibiotics. So they will let it go a few days. Now, if the kid's screaming in pain and they're looking at the inside of the ear and it looks like the pressure is building up on the eardrum, they will start to prescribe antibiotics. Otitis media is what we normally think of as an ear infection, but then we have otitis externa, which is also known as swimmer's ear, okay? But people will call this an ear infection too. This is an inflammation of the external ear canal, okay, and it's usually caused by bacteria or fungus. It usually is picked up from swimming. Swimming in a pool, you can, irritate it from the chlorine, and then the normal earwax that clears out the bacteria and fungus can be affected. When you go swimming in lakes and oceans, there are lots of other things in there. Um, it's very painful. You can get a fever with this. You can get a pussy exudate, okay? So one of the things is they will prescribe antibiotics for this. Usually this is when you get that hearing loss. It sounds muffled or muted. Um, a common everyday thing, if people tend to get this frequently, is they will say after you are swimming to just put a couple drops of rubbing alcohol in your ear. Mastoiditis, okay, is a little bit more, um, how do I want to, I don't want to say severe, but what it's talking about is the mastoid bone is the top jaw bone. It's the bone that holds your ear in place, basically, like where the bottom of your ear meets your jaw. That's where the mastoid bone is, okay? So acute mastoiditis usually results in a middle ear infection, okay? And this is where you have that terrible ringing in your ears, you've got ear pain, okay? Of course, they're gonna try to get the ear to drain with decongestants and antibiotics, excuse me. But if it gets very serious, they can do a mastoidectomy to relieve the pressure. Deafness. Deafness affects more than 25 million people. Excuse me, I'm gonna take a drink of water. There are two types of deafness. Conductive, okay, and this is caused by an impacted wax in your ear or cerumen, by otosclerosis, where the bones in your ear become sclerotic, or a ruptured eardrum. This is caused by external or middle ear disorders that decrease or stop sound conduction. Okay. The other type of deafness is sensory. Okay. And this is a cochlear or auditory nerve damage, okay, which prevents sound to be carried to the brain. It can be related to damaging noise level. It can be related to the side effects of some medications, or someone could be born this way. Impacted cerumen. Cerumen is just known as earwax, okay? If you really want to amuse yourself, go to YouTube and Google earwax removal. You could spend hours looking at how they pull different types of earwax out of people's ears. And it's gross, but it's fascinating at the same time, okay? The causes of impacted earwax. Your skin gets dry. Okay, when your skin gets dry, those skin cells slough off. They don't always come out. Sometimes they go in and get caught in with the earwax. People who have hair growing in their ear canals, the hair can get stuck in the earwax. Um, Dust in your home, a narrow ear canal. So the treatment is ear irrigation. And that is when they flush the ears out with a warm solution, but sometimes it doesn't always come out. And that's when they have to use a little bit of they do use different types of tools to get the earwax out. It is not a pleasant experience. Um, but like I said, if there's, when somebody can't hear, the first thing they're going to do is check for impacted earwax. And another reason it becomes impacted is people try to get it out on their own. They'll use their finger, they'll use Q-tips, and the farther the Q-tip goes in, most likely the more it's going to push it against the eardrum. Otosclerosis, I talked about this before. This is when the middle ear bones don't allow vibrations. They become fixed. They sclerose in place. One of the treatments that they can do is to remove the stapes bone, and sometimes that provides a little bit more room for the other two bones to do the vibrating. Sensory neural deafness, okay? This is deafness which is due to damage to the cochlea, okay, or the auditory nerve. Um, Again, it can be damaged due to exposure to loud noise. This is the type of deafness that soldiers in the military experience when they do not use headgear, um, when they're firing their guns or firing bombs, things like that. Um, this is a damage that occurs when people go practice shooting guns without having ear protection on. The damage is often permanent. This can be we are seeing an increase in this due to people wearing earbuds and playing very loud music on a high dose basis. It's not going to hurt if you do it, infrequently, but there are some people who, have their earbuds in constantly and it's very loud. So, you'll hear your grandmother say, "You're going to go deaf if you keep listening to that music that loud," and that's what they mean. This deafness type occurred in factory workers before OSHA had headgear, ear gear, ear plugs and things like that. So this deafness is usually due to exposure to loud noise, okay? But it also can be because something happened where the patient was born with an auditory nerve defect or a cochlear defect. Um, pres Presbycusis, okay? This is what we think of as old age deafness, okay? We don't know why it onsets, but we know that symptoms usually begin after age 50. This is why most people who need a hearing aid are my age or older, okay? Motion sickness is actually an ear problem, okay? This is when you're experiencing nausea when traveling by car, boat, or airplane. The symptoms are nausea, vomiting, diaphoresis, you get very sweaty, or vertigo. You just feel like you're moving constantly. Um, there's three types of treatment. You can take anti-motion sickness medication, but it usually makes people drowsy. They can try to rest. They can try to close their eyes. Another thing that it can be very helpful is applying special bracelets to your wrist, and for some reason that blocks whatever vibrations are going to your ears, that makes you feel like your motion sickness. Closing your eyes can also help, but they know that the eyes and the ears have a lot to do with motion sickness. Okay, now we're going to get into the trauma diseases. A corneal abrasion, okay? This can be when something is trapped between the eyelid and the cornea, okay? Um, ill-fitting or old contact lenses can cause it. Accidentally poking your finger in the eye, dust, um, something flying into your eye. It can be caused by extreme light when people are welding. The biggest thing is to remove the obstruction, but many times it's so small we can't see it. So that's why when you go to the eye doctor, they can magnify it and get it out. They will usually prescribe an antibiotic ointment and some analgesics. They may apply a pressure dressing to prevent the eye from moving. Um, and when people have a corneal abrasion, again, they are very sensitive to light, so they may also cover the eye to reduce photophobia pain. A retinal detachment, this often occurs with, again, a trauma, some type of accident to the eye, diabetes, or it can occur from another disease in the retina. The symptoms of a detached retina are blurry vision, flashes of lights, and people will say they see floating spots. Okay, that there just are floaters in their eyes and they see these spots everywhere. It can be painless, but it needs attention, and surgery is usually the ultimate treatment for it. I'm going to show you the next slide, and this shows the white line is considered the retina, okay? And usually it's attached to the sclera with the choroid. So this person, their their retina is not only detached, there is a hole in it. So this can be surgically fixed, but then they insert gas into the eye to hold the retina against the choroid while it's healing. And that's why people have to be lying face down after they have this surgery for a couple weeks, because that gas that is in there, that is literally a balloon that is holding the retina in place while it heals, can be affected by moving around and by altitude. So usually the only things you're allowed to do is get up to go to the bathroom and maybe take 10 minutes for a meal a couple times a day. But other than that, you have to lie face down in a special pillow and allow it to heal. You can't go in airplanes, you can't drive in mountains, okay? It is so important, that 2-week post-surgical period for retinal detachment. Now we're going to flip back to the ear. Obviously, a ruptured eardrum or tympanic membrane can be caused a couple ways. It can be caused by a middle ear infection that will not go away, and it can be caused by sticking a sharp object in the ear canal. A Q-tip can actually rupture the eardrum. Okay. Um, if a middle ear infection is really bad and they see that the eardrum is ready to burst, they will lance it with a tiny scalpel, because it is much easier to stitch a clean incision than if the membrane ruptured. And when it ruptures, it tends to tear. And when they suture it back together, it usually does not completely go back together. Okay. So if they noticed it's bulging really bad due to infection, they will lance it, and then they will culture whatever comes out of it. And hopefully they can do a culture and sensitivity to get the correct antibiotic to mitigate that middle ear infection. Um, Sometimes the pain is excruciating for patients. They will say, I can't hear you. It sounds very muffled. They can have bloody or purulent, very pus-filled discharge. Okay. So they, again, try to, if it ruptures, they will give antibiotics. Okay. They can try to patch it with a membrane using some tissue from your body. But if they know it's getting ready to rupture, like I said, they will lice it or lance it to get the pressure released before it rips. Retinoblastoma. This is a very rare disease. It's an eye tumor that's seen during infancy and childhood. Okay. If it's not treated, it's fatal. Okay. Um, the treatment is enucleation, where they try to, um, how do I want to describe this? They basically try to stop it from multiplying. Okay. So there are some chemicals they can use. There's radiation, there's chemo. Thank goodness it's not very prevalent. But again, it only occurs in infancy and childhood. Again, another reason babies every visit, and children every visit, they get an eye exam. Many ears disease is another very rare disease. This is a chronic disease of the inner ear. Um, the symptoms are, you hear that ringing, or you have tinnitus, you have the vertigo, the ear feels very full, and the hearing loss is progressive. So usually it only lasts a few hours to several days. The treatment, they have found that by giving a low salt diet, um, and antihistamines and nausea medicine, they can usually reverse this, but they may have to do surgery to treat some of the symptoms. So the effects of aging on the eye. Um, you know, we see as we get older that we don't have the ability to focus on near objects, sometimes color perceptions, very sensitive to light, decreased visual acuity, so the clarity and the blurriness can come and go. We see a very high increase of glaucoma and cataracts in our aging population. And we can also see fat and cholesterol deposits in the eye, which is called arcus senilis. And, that's a thing people don't talk about very much, but the eye doctor can see those inside. It's not like we can see the fat and cholesterol just externally in someone's eye. And of course, the effects of aging on the ear. Their tympanic membrane gets thinner and less flexible. That means sound is not conducted as easily. And we will see degenerative changes in the neurons. If their auditory nerve, if the neurons aren't conducting, the auditory nerve isn't going to process sound as easily. The bones of their middle ear, we've talked about how they can calcify, and the cochlea becomes less flexible. So, these are two things that we have gotten better with in our society by providing eye care and providing a lot of ear care. But I think we need to do better. I think we need to make hearing aids covered by Medicare, and because hearing aids can be very expensive. Um, the better the hearing aid and the better the quality of hearing, um, you can get into $5,000 per ear for a hearing aid, and it's not covered by Medicare, and it's not covered by most secondary insurances either. Um, and I truly believe that when someone can't hear, when they go to the physician, they may not be as compliant because they may not understand. Um, I always encourage elderly people to take someone with them to the doctor, who's a little bit younger and can be a second pair of ears to hear what's going on. I think the effects of aging on the eyes can also cause issues. Glasses aren't covered either by Medicare. And again, if we want people to be independent and be compliant with treatments, they have to be able to see the prescriptions on their prescription bottles, things like that. Um, so that's just my little commentary on it. Does anybody have anything else they would like to add?
I have a quick question. So you said hearing aids aren't covered by Medicare, but what if like I know my cousin had cancer when he was like little, and then he started slowly losing his hearing, and he has like hearing aids right now. And I never actually got to ask him like whether it was covered or not. Do you think it was covered?
I don't know. If it's a disability, they may be, but I know as people grow that um, they have to get bigger ones. So I'm not
Mhm.
sure, Amy. I wish I'd be able to answer that a little bit better. What else?
Cause like
Anybody else have any questions? All right, my friends. Well, I will see you next week. Everybody stay healthy and wash your hands, okay?
All right, you too.
All righty. Take care, everyone.
Bye.
Bye.